Mrs. Sita Lakshmi Iyengar. I am from Thane. I had leg pain as well as my pain in my right hand palm. I was not able to fold my hand and I had senselessness, and even in the left hand it was there. So first I wanted to solve my leg problem. I went to Dr. Sandeep Vaidya, and then I showed him my hand also. He referred me to Parag Lad for my problem in my hand. My leg problem is solved. Now Parag Lad gave me all details about what has happened to me. He first explained what is wrong with me. I used every day morning, whenever I read paper, whenever I cast like this, both the hands used to become numb, and then the fingers I couldn't fold and then get it back. Once it folded, it used to remain like that only. I had very painful it was to bring it back. So Parag Lad explained me everything and what is wrong with me, and initially he gave me some medicines to take for a week. Then he said, let us decide whether you need surgery or not. So the way he explained, I have confidence. Slightly I was afraid also, because my right hand, I had to do all the work. So, but the way he explained, I am really satisfied I was. So the next time when I visited him, he said, your medicines initially I have given, now we can fix the date for surgery. I said, surgery? I was a little shocked. Then he said, nothing to worry. Two things we have to do. The one thing, tendon has become very thick, that has to be removed. My nerve compression was there, that is because of that senselessness was there. So he explained me top to bottom. So I had no doubt at all, and he asked me again and again, if you want anything, you please tell me. So the way he talked to me, I was very much impressed. I agreed for the operation, and then the morning the operation went on very well. I was awake only. He explained me whatever he took away, whatever he did, everything, even in the operation theatre. So I had no fear. I was relieved of everything. And then the other hand also, he gave me some steroid injections. That hand also, he said, nothing to worry. Now within 2 months, that hand will also be all right. So that encouragement, the word, the thing what he gave really changed my lifestyle now. I am happy that I come back to normal life now. And then after the operation, he removed my stitches and he gave me all ointment and everything. He told me that after some time you see that your hand will have no mark at all. Same thing, it is now almost disappeared. I am as normal as nobody can find out also that I got operated. And what about the staff? All are very cooperative, very attentive. Especially I want to tell this hospital is very well equipped and all good staff are there, very attentive, and everything tip top, I can say. Even administrative work, bill, payment, pharmacy, everything is very good, nothing to complain. And we had some insurance. Immediately the administrative people, they cooperated with us, they filled the form, they got the sign, everything they did for us. We had nothing to worry. So I can say anybody in future, I want to refer this to this hospital to anybody, whoever is in need. That's all I can say. I am really grateful to these people and the doctor and all the staff and everybody. I am very happy.
Hello, I am Mr. R.D. Iyengar. I am a textile graduate. Regarding this hospital, if you want, because this was referred by my daughter actually. We didn't know this Pinnacle Hospital is here. So we searched in Google, and in Google we found this Sandeep Vaidya and all. And then we just came here for her some leg problem, my missus. Then we came for leg problem and it went to hand actually. The other way it happened. Nothing much, but he said for hand just I will call Dr. Parag Lad. Then he called Parag Lad and he examined her completely and suggested the surgery. Then initially she was afraid and I was also, surgery means what, cutting hand and all. But anyway, it was the way he explained and all, we found that it is nothing simple. So we said, okay, carry on. And he said, you fix up the date and time and all some tests to be taken, that is done. And we came here. And after the treatment, I found that really, it was really interesting thing. And even doctor, when he done the surgery, he said it's a really great surgery. He said, what he used some word, I forgot that actually, but it's a nice surgery has done. And then now she has improved a lot. And then it's a very, very nice hospital and up to date. I means actually what I found is it's very neat and clean and very hygienic. And really I have seen so many hospitals also, but this is really one of the, I can say, best hospital, at least in Thane. Bombay hospitals I have not seen much, but this is one of the best hospital in Thane. You can say number one actually. And all the staff and all also very cooperative. Anything we want to ask and all, they used to reply very softly and correctly. And second thing is, I wanted to say, this is a Pinnacle Ortho Centre. I thought it's not only Pinnacle, it's a miracle center. Anything happens here, everything is like a miracle. After the surgery, you can say what a miracle has happened.
Hello, I am Dr Parag Lad. I am a consultant hand surgeon at Pinnacle Ortho Centre. Nowadays, we most commonly see two important problems in a growing age group of people. Number one problem is called compressive neuropathy in the hand, and second problem is called tendinopathy in the hand. The difference between these two problems is sometimes patient has, apart from pain, they always have numbness in the hand. Usually the finger movements are possible, and that's why their activities of daily living do not hamper, and their main complaint is numbness in the fingertips. This numbness sometimes increases at night or sometime while talking on phone or while working in a kitchen, and usually it is in the both hands, but dominant hand the symptoms are more prominent. That means in compressive neuropathy, nerve is involved. It gets compressed in particular tight tunnel called carpal tunnel. And the second problem which I explained is tendinopathies in hand. Means tendons are the structures which are responsible for movements of the finger. Again, because of the tight tunnels in the palm, these tendons get stuck at one particular site. So whenever any patient makes a fist, and when she or he tries to open the fist or straighten the finger, that finger gets locked in the palm, and that's why while making it straight, it is very, very painful. Usually one or more than two fingers are also affected in the hand. Most common is thumb followed by middle and ring finger. Here I am going to present a case of carpal tunnel syndrome and a trigger finger in a 73-year-old lady. She was suffering with numbness in the thumb, index and middle finger since 1 year, and pain in one middle finger of the left hand and ring finger of the right hand, because of while making a fist she used to have locking sensation, or her finger used to get locked while making a fist, and when she was trying to open the fist, then the finger used to get stuck, and she may used to take the help of other hand to make the finger straight. We diagnosed her problem by nerve conduction study, and it showed a tight tunnel in which median nerve, which is responsible for sensations in the thumb, index and middle finger, it got compressed. Usually if we diagnose these cases in early stages, they respond very well to medical management like medicines. But once the symptoms are too aggressive, then we need to do surgery for these patients. The surgery is to decompress the nerve, and it is done under local anesthesia. It is reasonably safe. It consumes less timing, and usually patient is at home as on a daycare basis or in 24 hours. Post-operatively, for surgery, pain may remain for 2 weeks to 3 weeks, but it gradually reduces, and symptoms at least do not worsen after the surgery. and they start feeling better in terms of hand movements and numbness probably 1 or 2 months post surgery. Message here is, if we don't offer surgery at the right time, then the nerve is there is a possibility of having nerve ischemia, or circulation to the nerve is compromised significantly, and their thumb function and sensations at the fingertip is reduced significantly. So my message is, kindly do not ignore the symptoms of pain, numbness and weakness in the hand. Please consult your hand surgeon at the earliest. Thank you.